long-term hand health video. This is going to start with the follow along video where we start by warming up our hands. Do 20 to 30, even up to 50 or 80 hand rubs to increase circulation and to start movement into the elbow, forearm, wrist, and hand. Once you feel the increase in temperature, the warmth, we can open our fingers or abduct our fingers and start tapping the fingers together. Again, at least 10 to 20 times. For those of you who are stiffer, tighter, or have had longer term hand problems, we'll need to do this maybe 50 or 80 times. Already I'm starting to feel the heat from the friction between my fingers. Next, I'm going to do 20 to 30 back, wrist, and back of hand taps. Again, this is designed to increase circulation. 20 to 30 times. Even more for those who are stiffer and tighter. Next, we're doing a carpal tunnel tap, or the volar aspect of the wrist, or the palmar aspect of the wrist, the front side of the wrist, 20 to 30 times or more. Okay, now I see my hands are turning a little bit pink. They're getting warm, and now I know that I've improved circulation. Next, I'm going to treat each joint. You don't want to neglect your joints. This is blocked IP movement. This end joint is known as distal, further away, interphalangeal joint, otherwise known as the end knuckle. We recommend at least 20 repetitions of blocked flexion and extension of each knuckle. Let's do 10, 4, 5, 6, 7, 8, 9, 10. This also helps prevent other problems like tendon problems, because these tendons in some areas of our wrist and hand have two tendons in one sheath. 9, 10. Okay, now we're on to the small finger. We're flexing, extending, flexing, extending, bending, extending. 6, 7, 8, 9, 10. Okay, let's not forget the thumb. 4, 5, 6, 7, 8, 9, 10. Okay, moving to the other side. Here we're using what's called flexor pollicis longus. It's a muscle that starts in your forearm and ends to the tip of your thumb. And as we extend, we're using extensor pollicis longus. So these movements are very isolatory. These exercises are designed to isolate particular muscles. Again, we want at least 10 to 20 times blocked motion. 1, 2, 3. You can see the tendons on the back of my hand. You can see some of the forearm muscles even flex where these muscles start. These muscles start clear up in the forearm, and like a puppet, they make our fingers work. It's absolutely amazing. Already, my fingers are moving better. They're less stiff and they're less sore. Again, starting dose, 10 to 20 times each knuckle. 6, 7, 8, 9, 10. Okay, small finger. Normal motion is 80 to 90 degrees of bend and slight hyperextension. So once you start to lose this motion, if you don't restore it and maintain it, you will get osteoarthritic change. You'll get these little bumps on these knuckles called Herbin's nodes, which is a foreshore sign of arthritic change in these knuckles. And then you can get bumps on your middle knuckles called Bouchard's nodes, also a sign of arthritic change. Next, we're going to go into more gross motion. Here we're getting elbow, wrist, elbow, and forearm and hand all at the same time. We're doing 10 to 20 clockwise, 10 to 20 counterclockwise. For those of you who are stiffer, tighter, who've had symptoms or pathology for longer, it'll often take more repetitions and a longer time to have a better long-term outcome. Next, I'm making fists and doing 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. And then the other way. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, next are global tendon glides. And this is where a grip called the intrinsic position, intrinsic minus position, or what some guy called the gas cue grip. Really, it's activation of the intrinsics, holding like a hamburger, and then pulling your hand back and pulling your fingers back to stretch the deep hand muscles. These are called intrinsic muscles. Intrinsic muscles of the hand start in the hand and stay in the hand. The extrinsic muscles of the hand start in the forearm and end in the hand. So I'm going to pull back, hold for 4 to 5 breaths, repeat 2 to 3 times. Okay, now we're going to do global tendon glides. So we're going to bend the tips of the knuckle first, then the middle knuckles, then the metacarpals, then make a fist and flex the wrist. Extend the wrist, extend the MCPs, the PIPs, and the IPs. This is a wonderful handheld video for long term. If you're a musician, if you're a pianist, if you're anybody that uses your hands a lot and you want to prevent pain, pathology, pressure on your nerves that cross the wrist hand, this exercise video is for you. Initial starting dose, 10 to 20 times. Lastly, we're going to bring in full body motion because we cannot forget that the nerves that come off of the spinal cord in our neck, that go down through the muscles in our neck, that go down under our collarbone, down under our deep pec muscle, and into the arm and all the way down can be affected. So we want global motions like stay away, median nerve glide to help prevent carpal tunnel syndrome. I like 10 to 20 times. More if I'm stiffer, tighter, or have symptom. I'm pulling the shoulder blade back and down as I push the wall or surface away. Do 10 more. Okay, next is the ulnar nerve. I discussed cubital tunnel syndrome in a previous video. This ulnar nerve will come down from the inner side of the elbow and into the wrist and hand. This one we can do what's called the halo mobilization, neural mobilization of ulnar nerve. 10 to 20 times, 2 to 3 sets. 4, 5, 6, 7, 8, 9, 10. Maybe you're a person who has limited shoulder motion. Maybe you had an old shoulder injury. We can do ulnar nerve glides down lower if need be. So imagine bringing your thumb and index finger to your hand, keeping your 4th and 5th digit open, and do 10 to 20 ulnar nerve glides. 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now we're bringing it all together. So as I flex my wrists up, I'm extending them looking down. 1 to 2 breaths. Repeat 5 to 10 times. I feel warmth. I feel increased circulation from my arms clear down to my hands. Remember, the nerves that end in the hands start from the nerves in your neck. Next is called the T. Look at your own hand. Reach for the wall. 1 to 2 breaths. Palm up, spreading your fingers, open hand. 2 breaths. And now we're going to do alternating palm looks. 5 to 10 times each way. My arms have a little sense of fatigue or tiredness, so this can also improve your endurance of your shoulder, scapular, and upper extremity muscles, and thus improve function, prevent pain and injury. Last, interlock. Point the thumbs away and look overhead. Bend the thumbs back. 1 to 2 breaths. 5 to 10 times. This can also prevent or resolve neck pain, neck pathology, shoulder pain, shoulder pathology. I've even had patients tell me it's helped their mid-back as well. Our goal is to move like a child and to stay mobile and symmetrical as long as we can throughout the lifespan. We need to do this by maintaining or restoring and maintaining our range of motion. I hope you like this video. This is Dr. J with the Human Movement Institute, where we have improvement through movement.